So as we go from 100% saturated to 75% saturated, oxygen is being unloaded, okay, into the tissues. Okay. Now, the normal dissociation curve, oxygen-hemoglobin dissociation curve, is in the middle here. Sometimes the curve can shift. Okay. One of the factors that causes a shift in the curve is changes in pH. Okay. Let's suppose a particular tissue is hypoxic. Okay. It's not getting enough blood flow. Okay, so not enough oxygen is being delivered to that tissue. Then what happens is that tissue has to break down glucose anaerobically without oxygen. So that glucose can be broken down using glycolysis into pyruvate. In fact, each glucose is broken down into 2 pyruvate molecules. But if there's no oxygen, if that tissue is hypoxic, then the pyruvate can't enter into the mitochondria to participate in the Krebs cycle, which requires oxygen. So instead, in the setting of hypoxemia or hypoxic tissue, that pyruvate gets converted instead to lactic acid. And of course, acids release hydrogen ions. They cause the pH of the tissue to fall. Okay. So lactic acid, like any other acid, is going to release hydrogen. As the hydrogen content of that tissue increases, the pH falls. How does this happen? Let's say you're running a race, okay? And the demand for oxygen by the muscle outpaces the supply. Well, then that tissue is going to become hypoxic, not going to receive enough oxygen, and so it's going to start depending upon anaerobic metabolism, which generates acid, which lowers the pH of that tissue. Okay? At a lower pH, the oxygen-hemoglobin dissociation curve shifts to the right. Okay? So, for instance, if typically a tissue has a PO2 of 40 millimeters of mercury, okay, as a result of this rightward shift, for the same PO2, hemoglobin saturation drops even further. Instead of being 75%, it's closer to 60%. That means when that hemoglobin reaches hypoxic tissue, its affinity for oxygen drops even further, and it gives up oxygen more freely. Well, that's a good thing. That's a good response to hypoxemia. Now hemoglobin is releasing even more oxygen, okay, which has the same, perhaps, concentration of dissolved oxygen, but it gives it up more freely because that tissue is in greater need. On the other hand, if the pH was high, we'd see the opposite effect. All right, let's do a little randomization. Okay. Let's see. JJ, you're going to represent tissue. Just be over here. Just go on. Okay. Chris, come on up here. You're going to represent the hemoglobin molecule. Okay. And then, let's see something. Sarah, Abby, Alex, and Hunter. Okay. All of you ladies are his oxygen molecules. You're kind of attached to Chris, okay? Because here in the lungs, the PO2 is high. So this is not anything. Just go ahead and just grab onto him, if you don't mind. Just grab a shoulder. Yeah. This doesn't mean anything. This is just he's hemoglobin. You guys are oxygen, okay? We're in a very, very well-oxygenated environment here. We're in the lungs. Now, let's all move like this. Let's chug along with the bloodstream to an environment where the the oxygen content is lower, okay? Dissolved oxygen content is lower. Then you're not going to have the same affinity for these four ladies, okay? And so you're going to release one of them, okay, to this tissue because the atmosphere has a lower oxygen content. Now, when you go back to lungs, let's go back to lungs, where the oxygen content is higher. Come on here. All of a sudden, you pick up another lady. Okay? Now, let's do this now. Okay, let's reset. Cat, sit down. Alex, over here. Now, what I want you to do now is I want you to do a little jogging. Okay? Okay? And you're producing a little bit of lactic acid. Okay? Now come over with your ladies. Hold on. Now, this tissue maybe has the same dissolved oxygen content, but the pH is lower. Okay? Now, what are you going to do? Give release 2. Okay, and then go back. Okay? Okay? Because that tissue needs more oxygen. Right. So, does that help, Betty?
Yeah.
Okay, you can stop.
Okay. Because I was trying to produce lactic acid.
Right, you were creating effect.
Yes.
And we call that good. Okay. So our oxyhemoglobin dissociation curve shifts to the right. Now, the same thing would happen if there's a change in PCO2. A normal PCO2 is around 40. Okay? If the PCO2 is higher, why? Because the tissue is more metabolically active. It's breaking down more glucose, it's producing more CO2. Then, when that oxygenated hemoglobin reaches the tissue, its curve is going to shift, and it's going to release more freely. Okay? So again, with elevated levels of CO2, which reflect an increase in metabolism, the affinity of hemoglobin for oxygen is going to decrease, as reflected by a shift in the oxyhemoglobin dissociation curve to the right. So again, think of at the tissue level of PO2 is 40. If instead of having a PCO2 of 40, it's up to 80, then the affinity of hemoglobin for oxygen is going to be less. It's going to give up more oxygen. Of course, metabolically active tissue produces more heat. So temperature can also have an effect on the oxyhemoglobin dissociation curve. In the presence of higher temperature, like a fever, okay, the oxyhemoglobin dissociation curve also shifts to the right. Okay? So for the same PO2, the percent saturation falls even more. The affinity of hemoglobin for oxygen decreases and it releases more oxygen. All right, how y'all doing now? Is that making sense to everyone? This is tough, I know. We're almost done with this part, then we'll take a break. All right, the Bohr effect. Within tissues, this is what's going on. We're breaking down C6H12O6. What is that molecule? Glucose. And we're breaking it down with the help of oxygen. So this is aerobic metabolism. We're producing ATP, but we're also producing water and CO2. Okay? That CO2 is going to leave the tissue and enter into the bloodstream. In fact, we talked about the other day how the CO2 will react with water in the presence of carbonic anhydrase, produce a carbonic acid that dissociates into hydrogen and bicarb. The other day we said that the bicarb is going to leave the red blood cell and it will be carried in the plasma. Now, the hydrogen is going to result in a drop in pH, okay, within the blood cells. Okay? The drop in pH is going to shift this oxyhemoglobin dissociation curve rightward and decrease the affinity of hemoglobin for oxygen. So that as CO2 enters into the red blood cells, the affinity for hemoglobin for oxygen decreases. It releases oxygen more freely in the presence of CO2. Why? Because CO2 generates acid. and a decrease in pH shifts that curve. So as CO2 enters into the red blood cells, hemoglobin releases oxygen more freely. That's called the Bohr effect. The Haldane effect. What is that? Okay. As oxygen leaves hemoglobin, its affinity for CO2 increases. Even though oxygen and hemoglobin don't bind at the same sites, okay, the removal of oxygen increases that hemoglobin's affinity for CO2. So this allows CO2 to more easily piggyback a ride back to the lungs. Remember that when CO2 binds to hemoglobin, we call it carbaminohemoglobin. Okay. Let's take a break. Let's take a 5-minute break and then we'll finish up. Okay, how you doing with this? Brittany? You feel like if you had to rate yourself from 1 to 10, 10 being you understand it all. What's your level of understanding? Okay, yeah, you're going to have to go back and review this a little bit more. Well, and I think as you do the problems on that little quiz, not the other thing, it'll help you.
Can you go back to the last one? So it's just the Bohr effect, the drop in pH?
Yeah, the drop in pH within the red blood cell.
Okay.
It just causes that curve to shift and allows hemoglobin to release oxygen more freely.
The Bohr effect is really, is it kind of just that whole process, or is it?
It's a whole process.
specific? Okay.
It's the fact that as CO2 enters into the red blood cell, it releases oxygen more freely.
Gotcha. Decreases pH.
Is there a name for whenever the CO2 levels rise? I know when it's gonna
Well, when it rises in the blood, it's called hypercapnia.
Because I have PCO2 levels rise equals hypercapnia.
That's right.
So it's the same thing?
And really, well, that refers specifically to the CO2 in the blood,
Okay.
hypercapnia.
Okay.
Victoria, I forgot you were back there. Were you able to follow all this?
I believe so. I forgot to wear my shirt today that we talked about.
Oh,
yesterday.
yeah, well, next time.
Yeah.
Next time.
Or maybe not. I don't think that's a shirt for these two.
I think it's a good shirt.
It's a very comfortable shirt.
Yeah.
It's not a shirt.
Now, I'll tell you something. If you work in a critical care setting, like the ICU or the ER, this is the stuff you deal with all the time. So of all these things we've talked about with respect to the lungs and respiration, this is the stuff you deal with. Does everyone know Macy here?
Hi, Macy.
Hi, Nathan.
Hi.
She
uses the parade wave, I notice.
Because she loves parades.
I love parades.
She does.
Love parades.
Okay, no.
Let me see this one.
Macy, this is the good one.
That's what I was looking
Because you only want the best. That's why you're friends with me.
for. Sorry, guys.
It's all right. We're on a break.
Oh.
Have a quick break.
Okay. So, many times if a patient comes in with any type of respiratory difficulty, one of the tests that's performed is arterial blood gases, where the pH and gas content of arterial blood is assessed. In this case, the blood is typically drawn from the radial artery. Can it be drawn from another artery? It can, but the radial artery is usually the easiest to access. It's very close to the surface. It's easily palpable. Is it painful? Yes. Has anyone had blood gases drawn? It's much different from drawing blood from a superficial vein. That's not too painful. But drawing blood from the artery is painful. When the respiratory therapist hits the artery, the patient usually hits the ceiling. Okay. So, arterial blood gases are going to give you these measurements. pH. A normal arterial pH is around 7.4. It can range from 7.35 to 7.45. That's a normal range. A normal, now look here, instead of using an uppercase A, which would be for alveolus,